Good afternoon, everyone. Bonjour à toutes et à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. We are here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic. Nous sommes ici aujourd'hui pour vous fournir une mise à jour sur les mesures prises par la Ville d'Ottawa pour faire face à la pandémie du COVID-19. My name is Kendra Titley and I will be your moderator. Je m'appelle Kendra Titley et je serai l'animatrice de cette séance. Before we begin, a reminder to place your microphone on mute until I invite you to ask your question. Avant de commencer, j'aimerais vous rappeler de désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. Today, we will be hearing remarks from Mayor Le Maire Jim Watson, followed by Councillor Keith Egley, Chair, Ottawa Public Health Board, the Conseiller Keith Egley, Président du Conseil de santé d'Ottawa, Dr. Vera Etches, Chief Medical Officer of Health, Médecin-Chef en Santé Publique, and Kim Ayotte, General Manager of Emergency and Protective Services, Directeur Général des Services de Protection et d'Urgence. After we hear from the panelists, we will take questions from the media. We will now begin with remarks by Mayor Jim Watson.
Good afternoon, everyone. Happy New Year. Bon après-midi, mesdames et messieurs, et bonne année. Well, there's no easy way to say this, but the next 2 to 4 weeks are going to be some of the toughest weeks of this pandemic on all of us. Our seniors, our kids, our small businesses and restaurants, our students, and our families. But we don't have a lot of options to avoid some very difficult decisions. Yesterday, Premier Ford announced a return to a modified version of Step 2 of the reopening roadmap. Ottawa, along with the rest of the province, will be implementing new public health measures. This isn't how any of us wanted to welcome in 2022. Ottawa residents have done their part remarkably well, with 83% age 5 and older now fully vaccinated, and 90% of those 12 and older fully vaccinated. Third doses have ramped up quickly in recent weeks, with 39% of eligible population now boosted. 76% of residents over the age of 70 have received their booster shot, and this is well above the provincial average. We're all still on track to have everyone who wants a booster shot to be able to get one by the end of January. I want to thank all of the incredible nurses, doctors, paramedics, and other healthcare professionals who gave up their time over the holiday season to vaccinate Ottawa residents. La nouvelle variante est hautement contagieuse et présentait une nouvelle menace pour notre système de santé et pour nos petites entreprises. Je sais que c'est difficile pour tout le monde, mais nous sommes à un moment critique. I'm deeply concerned, of course, for our youngest residents and the lasting impact of school closures. The decision to keep children home from school for at least the next 2 weeks is difficult to hear. For many students, school is like a second home. Continuously opening and closing schools will have negative impacts on children well beyond the pandemic. I know this is hard for everyone, but we are at a critical time. As a city, we need to pull together to limit the spread of Omicron. We know what has to be done. Get vaccinated, including a booster when you're eligible, and take whatever brand has been offered. Both Moderna and Pfizer offer excellent protection regardless of which vaccine you got first. Wear a secure fitting medical grade mask, limit your contacts, practice physical distancing, and stay home and isolate if you're sick. And we need to look after each other. Check in and help those who may be in quarantine or who cannot get out. I saw firsthand how important that support is of family and friends and neighbors when I tested positive before Christmas and had to self-isolate for 10 days. I want to thank all of those who sent me many care packages and kind notes during that time. We also need to support our local businesses now more than ever, including takeout options for individuals who are running restaurants. Consider giving yourself and your family a break from cooking this week and order takeout or delivery from one of our many great local eateries in Ottawa. I know these are difficult restrictions to accept when we hope that these days were well behind us, but we need to put up the brakes on Omicron and help limit the spread. And we need to protect our healthcare system and all essential services, including frontline staff in our grocery stores and pharmacies, delivering goods and services, clearing snow and collecting our recycling. Nous devons arrêter cette variante et nous devons rester optimistes que nous y arriverons. I know the toll over the past 2 years has taken on so many people, and I want to remind residents that there are people and resources available to help you. The distress line, helpline is available 24 7, to provide crisis management and intervention, emotional support, and other services. And you can call the distress line at 613-238-3311. Alors, le numéro de téléphone pour le centre de distress is 613-238-3311. Please continue to look after yourself and others in the community. Thank you. Merci beaucoup. And I now ask Councillor Eglai to offer a few comments. Councillor.
Thank you very much, Mr. Mayor. Hello, bonjour, Quay. I want to begin by acknowledging that these are indeed challenging times. We are all tired. We're at a point where we're done with COVID. We want this pandemic to be over and for life to get back to normal. Unfortunately, it seems COVID is not quite done with us yet. I want to thank our local media who joined us today for the virtual briefing to hear the update and pose questions. The work you do in seeking out information and sharing with the public is invaluable. You are important partners, and we are very grateful. I also want to thank our healthcare partners, the hospital and community health center staff, who are running Ottawa's testing centers and the labs processing those tests. They all have been operating at capacity for many weeks. Everyone is working very hard and they're exhausted. I want to acknowledge them and recognize their efforts. Finally, I want to thank Dr. Etches and the entire OPH team for their efforts over the holidays. Ottawa Public Health has been monitoring the novel coronavirus, now known as COVID-19, since early January 2020. And here we are in January 2022. If anyone wants this pandemic to be over, it's public health workers. Nevertheless, they continue to work tirelessly to collect and analyze data, to keep residents and stakeholders informed, to rally the partners needed to respond to the pandemic, and to support the community as best they can. To the residents of Ottawa who may be watching this live on YouTube or who may watch it later or listen to clips on the evening news or on radio shows, I want to thank you for doing your part to keep informed, for continuing to follow public health guidance, and for getting vaccinated as soon as possible. But mostly, I want to thank you for your patience, your resilience, and your understanding. Throughout the pandemic, our objectives have been and continues to be to protect the health of Ottawa's population by limiting the potential spread of infection in our community while minimizing societal disruption. Decisions made by public health officials and politicians are not made easily. We all have families and loved ones who are affected, whether it's school-aged children, seniors, or others with ongoing health concerns. Our decisions affect us as well. Time, effort, and diligence is in play every time these decisions are made. And whether or not everyone agrees with them, and we acknowledge that not everyone agrees, the decisions are made in good faith and with the community's best interests at heart. If you or someone you know is having difficulty navigating these challenging times, please visit ottawapublichealth.ca/COVID mental health for a list of local resources. Parents and families can also find information and resources on OPH's Parenting in Ottawa website or the Parenting in Ottawa Facebook page. And older adults and their caregivers can find information and resources on OPH's Aging Well in Ottawa website or its Aging Well in Ottawa Facebook page. Now more than ever, I would encourage everyone to take some time for self-care. Take breaks, spend some time outside, do something that gives you happiness. Be kind to yourself and to those around you. If you have capacity, reach out to your friends, relatives, neighbors, or colleagues who may be struggling. Look out for one another, and please support our local businesses through these very difficult times. With that, I'll now turn it over to Dr. Etches to provide her update.
Thank you, Chair and Mayor. Bonjour, Quay. Based on what the province presented yesterday, we know that we are facing a significant challenge with the Omicron case counts rising exponentially and the number of new people testing positive that's expected in the days and weeks ahead. The government has projected that we need to do some work to be able to provide people with the hospital care that they will need throughout this month. So we expect this will have a large impact on the workforce across the healthcare sector, not only with the access to hospital beds and hospital-based services because of the large number, but because health workers themselves will be affected. So as Premier Ford and Dr. Moore said yesterday, almost everyone now will know someone who is or has been affected by COVID-19. We are bracing for the impact. We know that this at this point, the transmission of the Omicron variant cannot be completely stopped. So I agree with the provincial decision to introduce additional public health measures in the community with the goal to slow the transmission of the Omicron variant and just lower that peak of the hospitalizations that may be needed all at once to make it manageable. Comme l'ont dit hier le Premier ministre Ford et le Dr Moore, presque tout le monde connaîtra maintenant quelqu'un qui est touché ou a été touché par la COVID-19. Nous nous préparons aux retombées. Nous savons qu'à ce stade, la transmission de la variante Omicron ne peut être complètement arrêtée. Je souscris à la décision de la province d'instaurer des mesures de santé publique supplémentaires dans la collectivité avec l'objectif de ralentir la transmission du variant Omicron et de réduire le pic des hospitalisations à ce qui sera gérable, en reconnaissant qu'il est impossible d'arrêter complètement la transmission de ce variant. The provincial decision to delay in-person learning in schools must have been very difficult to make. We know that schools should be the last places to close for the health and well-being of children and youth. Now that the decision's been made to move to virtual learning for the next couple of weeks, we will work with school boards to ensure that children who may need more support can connect with the resources they and their families may need in the weeks ahead. Nous savons que les écoles devraient être le dernier endroit à fermer pour la santé et le bien-être des enfants et des jeunes. Nous allons collaborer avec les conseils scolaires pour nous assurer que les enfants qui pourraient avoir besoin d'un plus grand soutien puissent communiquer avec les ressources dont ils et leurs familles auront besoin dans les prochaines semaines. We know there will be harms from closing schools. For some children and youth, school is a place of respite where they can access support, food, and safety. Last year, the number of infants presenting with head injuries or multiple fractures more than doubled. And for families who face domestic violence, school is a protective factor. It's a place where they receive essential support. So we've seen from previous lockdowns that parents and caregivers report high levels of stress when schools are closed, when restrictions are in place and their ability to work is affected. Also, during previous periods when schools were closed for in-person learning, we saw more mental health challenges and increased hospitalizations with diagnoses such as depression and anxiety and eating disorders. So children and youth and their families are facing a tough time. It will be a difficult period to get through. It might be a few weeks or to a month. And so right now we need to do everything we can to take care of each other. It is more important than ever to reach out to friends and families and neighbors to offer support and give each other a break from what can be a challenging time. Il est plus important que jamais de communiquer avec des amis, des membres de la famille et des voisins, et offrir un soutien en vue de donner les uns et les autres un répit de ce qui sera une période difficile. So I will continue to advocate for schools to reopen as soon as possible for the health of children and youth. And through this period, parents will need extra help with childcare or remote learning. And so we want to weigh the risks of mixing with other children from other households outside of school. We know what's most important to prevent further transmission is to screen for symptoms daily and stay home when you're sick. So don't gather indoors with people outside your household unless it's for that essential support. Nous savons ce qui est le plus important pour prévenir les transmissions ultérieures. Dépistez chaque jour les symptômes. Restez à la maison lorsque vous êtes malade et ne pas avoir de rassemblement avec ceux hors de votre ménage à l'intérieur, sauf que la raison essentielle. And as the mayor and the chair mentioned, there are supports in the community to help you or someone you know. So there is the mental health crisis line, la ligne de crise en santé mentale, 24 heures sur 7, one call, one click for people to access mental health and addictions care. The distress line, many of these things, they're all listed on the Ottawa Public Health website. So unlike a year ago, when we lived through similar public health restrictions, we do have the protection of vaccinations now. And we're continuing to work hard to help older adults get their booster doses. And we're working to prioritize teachers and education workers, childcare workers to get their booster doses too. We also want to give children and youth access to their first doses as soon as possible, and we're preparing for the second doses to start by the end of January. We're entering a new year, and I know we'll take care of each other as we face these challenging times. We are a strong community that supports one another. Nous commençons une nouvelle année, et je sais que nous nous occuperons les uns des autres à mesure que nous gérons ensemble cette période difficile. Nous sommes une forte collectivité qui soutient les uns et les autres. Merci. Thank you, Miigwech.
Thank you, Dr. Etches. We will now hear remarks from Kim Ayotte.
Thank you. Good afternoon, everyone. Bonjour à tous. As you've heard, the Omicron variant is demanding new measures in Ottawa to slow its rapid transition. The city continues to focus on maintaining a safe environment for our staff and for the public as we adapt to these changing measures and conditions. Following the new provincial restrictions, which take effect at 12:01 a.m. tonight, all indoor city recreational and cultural facilities will close. This includes all reserved recreational activities, such as pool use, indoor ice rinks, fitness programs. Outdoor recreational facilities will continue with the capacity limits announced last week, a maximum of 25 people in most places, or fewer in order to maintain the 2-meter physical distance. Capacity limits to reflect 2-meter distance requirements are also posted at these rinks. The city will continue to operate respite centers, vaccine clinics, municipal childcare services, and inclusive recreational programs. These measures are in place for at least 21 days and until January 26. Bylaw and regulatory services remain committed to helping reduce the spread of COVID-19 to ensure the health and safety of our community by upholding provincial orders. Residents are encouraged to call 311 when they believe public health is at risk. Let's stay focused on protecting everyone safely. Merci. Thank you.
Thank you, Mr. Ayotte. I will now invite questions from each agency alphabetically. You may ask one question with a follow-up. Nous allons maintenant répondre aux questions de chaque organisme par ordre alphabétique. Vous pouvez poser une question et une question de suivi. Again, a reminder to remain on mute until I invite you to ask your question. We'll now start with Kate Porter at CBC Ottawa.
Thanks. Hi, everybody, and Happy New Year. My questions are for Dr. Etches. I know you told our morning show this morning, Dr. Etches, that you've received been told in writing that the public health unit is to turn away those who are, say, 4 or 17. Could you elaborate on why and the reasons that they were giving, just given so many people are interested in this, sort of hoping those who are about to have their birthdays could get their shots now rather than waiting till the birthday?
Yes, so I can recognize this has been pretty frustrating for families where that is the case, that you have a 4-year-old who's turning 5 this year. And if under the provincial policy last year, when the vaccine was first used for children, we were close to the end of the year. The provincial policy decision was for anyone turning 5 that year, they could come forward and have that vaccine. However, that policy is changed now, and what the province is moving to, it's changed, is that now people will be able to have the vaccine once they turn 5. And so that is in line with the Health Canada approval. When Health Canada approved the Pfizer vaccine, the pediatric vaccine, it was for 5-year-olds to 11-year-olds. So this policy decision now of the province follows that approval. It is frustrating because some people have been able to book appointments under the old policy, but that will change. The province is bringing the booking system in line with the policy decision. So what we're doing is trying to reach out, working with the province to let people know who might have an appointment. They don't need to go to the clinic to be shown, to show up and be turned away. So we're trying to make sure that people get that notice.
And my follow-up relates to those few who, rushed out and got their shots yesterday when they're 4, and then they would expect to get the second dose in the 8-week period. So what should they do? Will they not be given that second dose now?
Well, I think that's a good question, and we'll make sure we can get back to the families with the answer when it's clearer. We have their contact information, and we'll be reaching out.
Okay, thank you.
Thank you very much. We'll now go to Ted Raymond at CTV Ottawa.
Hi there, can you hear me okay?
Yeah.
Okay, perfect. So my first question, I'm going to ask this to Mayor Watson and to Dr. Etches both. I'm just looking to see if you've had a chance to speak with the province yet, or if you've spoken with them over the holiday break. I'd like to know what specific actions the province has told you they're taking with regard to improving safety in schools during this period of closure. And then for your side of it, what specific actions is Ottawa Public Health taking? What specific actions is the city taking? Do you have timelines and dates, that sort of thing? I'm just looking to see what we're going to be doing with this time that schools are closed to make them safer for everyone.
Dr. Etches?
Yes, thank you. So the communication we've had is from our Chief Medical Officer of Health, who outlined for the public the measures that he's looking to help the government introduce. So that means that teachers will have the ability to use N95 masks if they choose. It means they're increasing ventilation in schools with further distribution of the HEPA filters. And of course, making vaccination booster shots available to education workers and ongoing first doses for children. So what we can do locally, what Ottawa Public Health is doing with the city, and I invite Kim to speak to this, is that we are working to advertise, continue, make it obvious that this is a good time for 5 to 11s to come forward to be vaccinated with their first dose. We have neighborhood hubs where people who have not yet vaccinated their 5 to 11-year-old are being encouraged to just drop in if they're from that neighborhood. The vaccine booking option continues to exist for that age group. And we'll make sure that when the second doses come around, that capacity is there too. And we're working in partners with Kids Come First and others to then, provide new channels of access for the education and childcare sector. This is, a good protection to have your third dose. We know, actually, we're looking to make that available to everyone who wants it, whatever kind of essential worker. We know that if we stay on track here, we're expecting to be able to have anyone from any sector have their booster dose before the end of the month. So, I think the things we know about school, is that it is a controlled environment where typically we've seen more transmission for children, encountering COVID in their homes, in the social settings that they're in outside of school, than we've seen transmission in school. And so, we think they can open as soon as possible. And we know also that these other ways that schools support well-being are really important to have back in place as soon as possible.
Kim, did you want to add anything to that?
Well, I think it was well said. We're obviously continuing to advertise and trying to vaccinate our 5 to 11-year-olds as a priority group, as well as those over 60 and many others in our vulnerable communities as well. So we have many different programs out there. So continue to go to the Ottawa Public Health website to get that information and to book your vaccines.
Yeah, just on who I've had contact with, my last contact with the minister was about a week ago, and it was with the finance minister, where we discussed, among other things, support for workers of those who may be affected by another lockdown and support for small businesses. I didn't address schools with that minister at that time. Thank you.
Okay, thank you very much. My follow-up question then is again to Dr. Etches, just regarding daycare. Parents are concerned about some of them sending their children to daycare because of lack of access to testing, lack of access to rapid testing as well. And with schools being online, are you confident daycares are safe? Should they have more access to rapid testing? Can you get them more access to rapid testing, especially for kids who aren't old enough to be vaccinated?
I'm going to just start by going back again to this idea that we're in a different type of pandemic now, that Omicron has really changed how we approach this, where We're no longer looking to find, every person who's positive with a test and count and contain. We need to assume, because of the amount out there and the limits on our testing system, that if somebody has symptoms, it could be Omicron. And the best way to control transmission is for people to stay home with their household when they're sick. So for childcare, right now, they're not in the provincial list of priorities for testing. And so the limited supply of rapid antigen tests that we have is not there to be distributed to childcare settings. So I would encourage people to monitor for symptoms daily, to stay home if they're sick. That will protect against further onward transmission of the virus.
Thank you very much. Next, we have Craig Lord at Global News.
Hi there. Dr. Etches, you've said time and time again, excuse me, in the pandemic that school should be the last thing to close, but we're seeing indoor dining and recreational settings restricted at the same time as schools. I'm wondering, would you have liked to see the timing on that go differently? Maybe start with those public settings outside of schools and then in 2 weeks move on if there wasn't any change? Or how do you feel about how the province laid out these restrictions and the timing of how they came into effect?
I do think that community-based restrictions are appropriate given what the province is seeing in the projections, to be able to manage what's coming to the hospitals. I gave my professional opinion that I don't think opening schools worsens the transmission, significantly based on our previous experience in this pandemic. But I know this was a very hard decision to make. There are lots of factors, even operational factors, the availability of teachers that came into this. So, I think the focus now should be to look at how can we get schools back as soon as we can. And, we'll be doing our part to help with ongoing immunization and advice. And we'll continue that dialogue so that hopefully we can be ready on January 17th.
And kind of following up on that, you've spoken previously, I think even before Omicron was really hitting Ottawa, that once we get those second doses in the ages 5 to 11, around the February timeframe, we really start to see an impact. But we're also seeing so many breakthrough cases with Omicron. So are you still confident that once we get second doses, it'll make it easier for schools to stay open? Or how do you see that situation playing out come February and even after schools return to in-person in a couple of weeks, hopefully?
Yes, this is a hard one to answer because we just don't have that much experience with Omicron yet. What we've seen in other countries is that there's been a rapid increase, and then in South Africa, where it first occurred, it also a rapid decrease. So we can be hopeful that as Omicron comes through, it won't last as long, but we don't know for sure. We need to compare to other countries that are more like our country. We know that vaccination is protecting people from severe outcomes related to the Omicron infection. So vaccination is absolutely worth it. The 2 doses, good against hospitalization and severe illness, but the booster dose makes a difference as well, adds even stronger protection. So for children, again, it's new in terms of measuring this. It's harder to know because it's so rare that children are hospitalized to begin with. But we would expect vaccination would prepare the body to fight off the variant. And so all of that said, we also are seeing that it's not stopping infections and it's not stopping transmission from people who are vaccinated. And so that is continuing while we see less severe illness. So with children having 2 booster doses, I'm going to continue to recommend that we have that protection from vaccines. And I think we should end up after this wave. We're hearing we expect the peak to come near the end of January. We should end up in a place with more immunity across the board, being able to get back to the things that we need.
Thank you.
Thank you, Dr. Etches and Craig. Nous allons maintenant à Julien Paquette à la 3.
Bonjour. Pour clarifier, vous avez précisé plutôt être soutenir Dr. Etches, la question pour vous. Vous avez précisé soutenir les mesures qui ont été annoncées par la province hier. Vous aviez évidemment quelques jours plus tôt aussi indiqué que votre préférence aurait été de garder les écoles ouvertes. Est-ce que dans les mesures qui ont été annoncées hier, il y a d'autres fermetures, un peu comme les écoles que vous pensez qui n'auraient peut-être pas été nécessaires dans le fond? Est-ce qu'il y a des choses que vous auriez fait différemment un peu?
C'est sérieux quand il y a des gens qui ont besoin d'oxygène ou un lit dans un hôpital et ce n'est pas là pour eux. On a besoin d'éviter ça. Et les données de la province indiquent que c'est une situation qu'on peut avoir cette mois, sinon, s'il n'y a pas les mesures comme ça. Alors, je n'ai pas difficulté avec, c'est difficile d'avoir les mesures comme ça, mais je suis en accord que c'est important de limiter les contacts entre les gens à l'intérieur. Alors, je soutiens les mesures parce qu'ils sont pour attaquer le nombre de personnes à l'intérieur sans masque, en contact étroit. C'est où le COVID est transmissible. Et avec Omicron, c'est difficile de ralentir cette variante. Alors, on va continuer d'évaluer l'impact des mesures. On va continuer de modifier l'approche si on peut, si les chiffres dans les hôpitaux ne sont pas trop hauts. C'est certain, tout le monde a besoin de mesures plus légères si c'est possible.
Parfait. Merci. Et puis, pour ce qui est j'aimerais parler un peu de dépistage. Je comprends que, évidemment, dans les dernières semaines, on a eu un peu de difficulté à offrir des tests à tous ceux qui en auraient besoin. Comment arrivez-vous un peu à garder un regard étroit sur la situation, garder un bon portrait de la situation actuelle malgré, là, on voit à quel point, dans le fond, aussi, sont fiables les chiffres qu'on a, là. On avait presque 1000 cas annoncés hier, par exemple. Comment on obtient ces chiffres-là avec la situation actuelle?
Oui, c'est clair, quand on regarde notre site web maintenant, le nombre de dépistages positifs, ce n'est pas un bon indicateur concernant le niveau de COVID dans notre communauté, parce que les dépistages sont limités aux gens qui travaillent dans les hôpitaux, les centres de soins de longue durée, par exemple. C'est limité, mais nous avons deux autres mesures vraiment fortes qui continuent. Le haut usé, c'est là où on peut voir l'impact de Omicron, le variant Omicron. C'est presque 100% de la COVID-19 dans le haut usé maintenant, et aussi ça augmente. Alors, quand ça change, quand ça tourne, c'est possible d'avoir plus d'espoir que la vague aussi dans la communauté, la quantité de COVID-19 dans la communauté diminue encore. Et aussi, nous avons les hospitalisations et les gens dans le centre de soins intensifs. Pour Santé publique, Ottawa, les chiffres des hospitalisations sur notre site web, ils sont juste les gens dans les hôpitaux aux causes de COVID-19 ou qui ont besoin de traitement pour la COVID-19. Alors, ça aussi, c'est bon quand on peut voir une diminution dans cette chiffre. Ça prend un peu plus de temps après le pic de cas parce que c'est après une semaine ou deux où on peut voir les hospitalisations augmenter. Mais ils sont des bons indicateurs.
Merci.
Merci beaucoup. We'll now go to Liz Payne at the Ottawa Citizen.
Thank you. This is a question for Dr. Etches, I think, and you might be repeating some of this, so my apologies. But do you have a sense of what our real case count looks like right now versus what we are testing for, and how the hospitalizations under Omicron right now are comparing to, say, the Delta wave? Can you give us that?
Right, so the number of people who test positive is not a good indication of the amount of COVID in the community, because it's restricted to certain populations now, the hospital workers, the long-term care home workers, for example. So following that curve isn't going to help us. There's a couple of ways we can estimate, the number of people. We could follow the curve that was going almost straight up, exponential growth. The modeling that predicts really where are we now, and it is thousands and thousands. Others have suggested, well, maybe we're picking up 1/3 of the people testing positive, 1/10. It's clear it's a lot of COVID that's out there. So the hospitalizations, again, people are able to estimate what's the percentage of all the people testing positive that end up in hospital, and a conservative estimate the province is using was 1%. So you could extrapolate, but to me, we're not seeing that yet. That level in Ottawa, our hospitalizations are about 26 today, so I think we'll follow that curve of the hospitalizations to understand if the amount of COVID is continuing to grow. We'd see the hospitalizations growing, and then when it falls, we could have some confidence that also the amount of COVID in our community is decreasing. I'm not sure if that answered all of your questions there.
Yeah, I mean, I guess, okay, I will do a follow. I did want to know if you had sort of some modeling telling you where we're going, but
I don't have a number for Ottawa from modeling, but the science table, had put out some modeling. I think we're hoping to have an update on that, but I don't have anything specific to Ottawa right now.
okay.
What I know is that it will help. The speed of growth should slow with people limiting their contacts. So we would expect that exponential growth would start to slow now that people are limiting the number of people they're meeting up with indoors without masks.
Okay. Can I ask a follow unrelated to that, which is, I think, maybe for the mayor? I'm wondering if we are saying, I know Toronto has had to close some services because of staffing shortages across the board. Is there anything, how is the city being affected by people who are off with COVID right now and unable to provide either essential or other services?
Yeah, the latest briefing I received, Liz, is that we still have our services fully staffed. There may be occasional people calling in sick or having to go into self-isolation from time to time. For instance, we'll see bus drivers that have been tested positive, and they're off, obviously, for that 10-day period. But I'll ask him to follow up. But to the best of my knowledge at this point, we're still providing all of the services. Obviously, those services that are affected by the lockdown, recreation programs, many of those individuals will be reassigned to help with some of the vaccination clinics and testing sites and so on, as they've been doing for the last year and a half. Kim?
Thank you, Mr. Mayor. Yes, I can confirm that our services are still very, very active, and we haven't dropped in our level of service. And I know that some people have asked, how's that possible? Well, we're filling the spots in with overtime, and some people have canceled their vacation. So, when you consider all of those different types of mitigation factors, you can quickly see that we can still provide service. However, Omicron is spreading very quickly. So, we keep our fingers crossed, and we ask those who are sick to stay home, and hopefully those additional, physical distancing measures, et cetera, will help as well. And hopefully we'll all get through this soon enough. Thank you.
Okay, sorry, I just wanted to make sure I had something correct that Mayor Watson said. You said 10 days. It is a 5-day now, or is that different in Ottawa?
No, that's right, because I went through 10 days, so
Okay.
but it's 5 days, you're correct.
It is 5 days. Thank you.
Thank you, Liz. Next, we have Jackie Miller at the Ottawa Sun.
Hi, thank you. This is for Dr. Etches. I'm just wondering if you could clarify or be a bit more specific. You said that the city would try to prioritize booster shots for education and childcare workers. And I'm wondering how you will do that. Can they move up their appointments, or will there be special clinics for them? Because you also said that anyone could get a booster by the end of January. And I'm just wondering if for this group, they'll be able to get their booster sooner.
Yeah, it's a little early for me and Kim to announce the specific plan because it's still in the work with partners. But we are looking to have a new point of access in partnership with Kids Come First that would be hopefully stood up this week. And so in addition to the other channels, pharmacies, primary care, the provincial booking system, the neighborhood hubs, these are all options right now for everyone. And I want to encourage people, don't give up on thinking that you can get a booster dose appointment, because there are appointments being put up every week. And we do have a plan to have enough capacity for everyone who wants a booster shot within the next few weeks. So please don't think that you'll be left behind. There's going to be a spot for you within weeks. So when we have more details, we'll be able to confirm that.
Thank you. I was also wondering if you could tell us what, if any, contact tracing and reporting of COVID cases at schools will be done by OPH. The province has said that it won't report COVID cases in schools, and for the most part, close contacts will just be able to stay in class, won't have to go home and isolate. So will OPH track and report cases of COVID in schools to parents and the community in some way?
So I don't have the confirmed new guidance for how we'll work in schools. It's still to come. But what I can sort of speak to is if you take an extrapolation of the way testing and contact tracing has changed for the general public, it's in this environment where we don't have enough PCR testing, we don't have enough rapid antigen tests to test everybody with symptoms. So we have to assume it's Omicron and stay home for those 5 days. But we're not asking everyone's high-risk contact to stay home for 5 days. It's people who you live with. That's the group that needs to stay home. And so those high-risk contacts, what we're asking them to do is to monitor for symptoms, to self-monitor for 10 days. So within schools, you could imagine a similar approach where if somebody's sick, we ask them to stay home. Everyone needs to monitor for symptoms. What we'll be doing if we don't have information from testing is we'll be looking at absenteeism. So what's happening in schools, how many people are homesick. We'll be investigating if it looks like there's something that's challenging a school environment. But I don't have more detail at this point.
Thank you.
Thank you very much. Nous allons maintenant à Frédéric Pépin à Radio-Canada.
Oui, bonjour. La question est pour Monsieur le maire Watson, pour commencer. Bonjour, Monsieur le maire. Alors, je me demandais, Monsieur Watson, on voit du côté du Québec qu'il y a que les frontières demeurent ouvertes. Alors ça, de ce côté-là, vous devez être content. Vous étiez farouchement opposé à ça, mais je vous demande aujourd'hui, est-ce que vous pensez qu'un confinement, le couvre-feu, comme on voit au Québec, est-ce que c'est quelque chose qu'on devrait amener à Ottawa pour une protection supplémentaire?
Donc, expliquez qu'est-ce que c'est le couvre-feu.
Le couvre-feu, c'est que les gens au Québec, partout au Québec, doivent rester à la maison entre 22 heures le soir et 5 heures du matin. C'est un strict couvre-feu. Les gens n'ont pas le droit de sortir, sauf évidemment pour les raisons de travail là, ou des raisons exceptionnelles.
Oui, j'ai vu ça dans les nouvelles, certainement à la ville de Montréal aussi.
Oui.
Ben, ça, c'est vraiment une décision pour la province. À ce moment, je ne pense pas que ça, c'est nécessaire. Mon avis pour toute la population est rester dans votre ville. Ce n'est pas le temps pour faire des voyages à Gatineau ou à Ottawa ou vice-versa. C'est le temps de rester chez vous pour les prochaines quelques semaines. Alors, si ça, c'est nécessaire d'arriver à Ottawa parce que tu travailles comme une infirmière ou tu travailles dans un hôpital ou tu travailles dans le gouvernement fédéral, alors ça, c'est une bonne raison de faire un voyage entre les deux municipalités, mais seulement pour faire le shopping ou des choses comme ça, ce n'est pas une priorité pour nous et la population en ce moment. Merci.
Ma deuxième question serait pour vous, Dr. Etches. Vous l'avez un peu évoqué en anglais avec nos collègues, là, mais pouvez-vous me dire, pour ce qui est des hospitalisations, hier, Doug Ford parlait de 1% de tous les cas de COVID. 1%, c'est des hospitalisations. Est-ce que c'est ce qu'on voit présentement à Ottawa? Alors, juste peut-être me donner une comparaison et dites-moi aussi du côté des hôpitaux en ce moment, comment ça va, là? Est-ce qu'on est capable d'accueillir tout le monde et est-ce qu'on approche une situation critique ou non?
Oh, c'est difficile parce qu'on ne peut pas voir l'avenir. Et c'est important de considérer l'avenir parce que les hospitalisations suivent les personnes qui ont un dépistage positif ou qui ont des symptômes qui sont affectés par la COVID-19. À ce moment, on a plus de 10 000 personnes à Ottawa avec COVID-19, c'est certain, parce que c'est 9 000 confirmés par un dépistage. Et on dit que c'est peut-être 3 fois, 10 fois plus non confirmés. Alors, on n'a pas cette 1% dans les hôpitaux. On a 26 personnes dans les hôpitaux maintenant à Ottawa. Mais c'est une augmentation qu'on voit maintenant. Les hospitalisations ont doublé dans les semaines passées, 2 semaines passées. Alors, je pense que les mesures vont faire la différence pour les hôpitaux d'avoir la capacité de gérer la situation dans quelques semaines. Quand ils arrêtent avec les procédures, les surgeries non urgentes, ça crée capacité dans le système. Aussi, c'est intéressant avec cette variante Omicron, c'est pas la même quantité de personnes dans les hôpitaux, dans les soins intensifs. Alors, nous avons 4 personnes maintenant d'Ottawa qui ont besoin de soins intensifs. Alors, on va continuer de suivre les chiffres, mais c'est clair, l'augmentation peut arriver parce que la quantité de COVID-19 dans la communauté est vraiment haute.
Merci, Dr. Etches.
Next, we have Pat Ugugioni at Your Community Voice.
Yes, I'm not sure if my question would be for Kimia or Dr. Etches, but earlier in the pandemic, paramedic units went into the long-term care centers and retirement homes to make sure everybody got their doses. Is that happening now for the booster shots?
I could answer that. The paramedic service continues to help as much as they can. Again, we're always trying to manage our day-to-day operational requirements. And then we put out a call for those who are interested in helping out in their time off to come in and assist. And we do have an uptake on that. So it's not necessarily just for the long-term care homes, but for facilities across the city whenever we can. So the paramedic service has been certainly been used and it continue to be used for that purpose.
And Dr. Etches, what can a family member of someone living in one of these residences do to assure that their family member does get a booster shot?
I want to reassure people that long-term care homes and retirement homes are the top of our priority list for vaccination now. Not only the 3rd booster dose, but the 4th dose has just been approved. And so we are going back into each long-term care home and retirement home, or working with those retirement homes and long-term care homes for them to do the booster doses, whether it's the 3rd dose or the 4th dose, or vaccinating staff. So this is all on a very short timeline. Within the next 10 days, we have a schedule to really reach out to each home. Some homes are in outbreak, so we're having to modify the approach a little bit, but we know this is important for this population. And we have done a lot of training and capacity building so that long-term care homes now, they can order vaccine and deliver it themselves to their residents whenever it's needed. In retirement homes, they don't always have the same access to nursing staff, say, but there is a director of medical director of care for retirement homes often. So working with them to be able to ensure that, as we go forward, they can continue to provide boosters to people as needed.
Thank you very much.
Thank you very much. This is all the time that we have this afternoon. C'est tout le temps dont nous disposons aujourd'hui. Thank you. Have a great afternoon. Merci. Bonne journée.
Thank you. Merci. Au revoir.